So we're gonna start with ice on the knee for 10 to 15 minutes. Yes, before exercising. And we're gonna combine this with heel props, which we will cover later. So I'm gonna prop my heel on a chair, a coffee table, anything so that there's nothing underneath my knee. Then I'm going to place ice directly on top of my knee, right? Now, if you have access to a TENS unit, right, an electrical stimulation unit, we can add that on top of it. So just place the electrodes on either side of your knee, and then you're going to turn the intensity up on the machine until it's as strong but comfortable. And now most people think that ice is just for swelling and that it should be done after exercise. That's part of it, but in the context of an ACL injury, that's not the main reason why it's here. After surgery, your knee is healing. It's irritated. And that sends a signal to your brain, right, from your knee to your brain, that essentially tells your quad to stop firing effectively. The fancy term here is arthrogenic muscle inhibition. Your knee is shutting down your quad as a protective response, kind of like dimming the lights on how well your quad fires. So when you go to flex your quad, it doesn't fire the way it should, right? And it's not because the muscle is gone, right? You're gonna lose some muscle mass, but it's more so because the nervous system isn't letting it work, right? So ice and TENS help calm that down. They give the quad a window of opportunity to actually turn on. So that when we get into the quad work in a few minutes, you're not fighting your own nervous system the entire time. This is the warm-up, 10 to 15 minutes, then we move.